everyone. My name is Mary Cridge and I'm the Director of Adult Social Care here at CQC. Thank you all so much for joining us this morning. Let me introduce you to the team who are with me, I'm pleased to say. So we've got Dave and Jeanette from our policy squad, very important to this work. Amanda Stride is the newly appointed Deputy Director, who's going to help us deliver this work. Both Amanda and Dave will introduce themselves again as we get to their slides. And we have got Sam and Jen from our provider engagement team, and Ellen and Abigail and Steph here as well. It's amazing the squad it takes to get one of these on air, but here we are, and I'm very grateful you're with us. Just a few sort of ground rules to cover before we launch in. We really hope you find this time useful, of course. We hope everything will run smoothly. We have had a couple of technical hitches before we went live, but hopefully they won't happen again. But if they do, please just bear with us. We'll do our very best to stick to time. And the way this webinar is set up, I'm afraid it's only us who can speak and use our videos, but there is a chat function which I encourage you to use to make comments or ask questions. The team in the background will be monitoring that, and when we get to the question and answer session at the end, they'll be selecting the sort of most popular liked questions to ask. We're only going to be answering questions today related to the stuff that we're covering. Anything else we'll pick up separately. Just to say, this is one in a series, and unusually today's a double header. So there is another opportunity to come to one of these this afternoon. You can register up till an hour before kick-off, and Kate Tironi is going to be talking about the timeline for bringing in our new approach, and importantly the new provider portal. So providers on the call, if you can join at 3 and you're not already registered for that call, you might like to do that. So I want to talk to you a bit about our new powers, which I'm pleased to say did kick in. There's a bit of debate about whether they started on Saturday the 1st or Monday the 3rd, but aside from that, they're here. So we're really clear what our mission is now. We're going to just recap a bit on what we learned from the 2 test and learn assessments that we did last year in Manchester and Hampshire. We're going to be talking about when we'll be starting the formal assessments and show you the sort of the timeline and the next steps. And we've got the Q&A session at the end, and our aim is to leave plenty of time for that. And then we'll finish off by just confirming what the next steps are. So on that note, I'm going to hand over to Dave. Thank you.
Thanks very much, Mary, and hi everyone. So I'm going to talk through our new powers and the framework that we're applying. So as you may well be aware, the Health and Care Act has given us these new powers to assess both integrated care systems and also local authorities. And of course, today we're focusing on the latter there. That is specifically about how local authorities are meeting their duties under Part 1 of the Care Act. So it's not a kind of all-encompassing everything that local authorities might be doing around social care or beyond. It is limited to those aspects of their duties, and we're really pleased to have these powers. It has felt like a gap really in oversight of health and care. Of course, what happens, how local authorities deliver their duties and work with providers and others in the local area, a really important factor in determining the outcomes that people will experience. So it's a really important part of our role, and building on what already happens in terms of sector-led improvement and how local authorities invest and drive their own improvement. This assessment approach will complement that, and all of this is essentially about making sure that people experience high quality care and support, and that we drive improvement in areas where it's needed. So the framework, we can move on to the next slide, is we're drawing on our single assessment framework. So as you will all probably be aware, the framework which we're introducing to providers later on this year will be coming sooner for local authority assessment, and that framework essentially has 34 topics that sit under our 5 key questions. Now, the really important thing, there's a couple of really important things here to say, actually. The first is that at the heart of this framework are the Think Local, Act Personal I statements that we've brought across from their Making It Real framework, which are the authentic voice of what people say they expect from health and care and support services. So everything we've built through our engagement and our co-production to develop this framework emanates from those core expectations that people have articulated, and it's a really important part of our approach. Our single assessment framework has 5 key questions, as you know: safe, effective, caring, responsive and well led. For local authority assessment, we're not effectively working to those questions, and that's because not all of the framework applies to the Care Act. It's really important to just kind of reiterate that point, that we can only look at the Part 1 of the Care Act. So we're drawing on a subset of those quality statements, and there's 9 of those, and they effectively fit under 4 themes. So how does the local authority work with people? How does it deliver support? How does it ensure safety? And what's the quality of leadership? But there's a golden thread here from provider assessment, in terms of we're looking at a subset of those same standards that we're applying to providers, and the same is true for integrated care systems. We're applying the same evidence categories. So this is how we've developed our current approach of key lines of inquiry and prompts into these 6 core evidence categories. So in relation to the standards that those quality statements set out, those expectations and commitments, we'll be looking at what's people's experience, what are we hearing from staff and leaders, whether that's at providers or LAs or integrated care systems, what are we hearing from system partners, what do we observe? And actually, in the case of local authority assessment, that's not one of the evidence categories that we need to fulfill. We'll be using observation as part of our assessments. What can we learn from policies, processes, and procedures, and what does the outcomes data tell us? All of that then is generic, essentially, across everything that we do, whether that's provider, local authority, integrated care system. And where it gets tailored to this specific area of focus is at that bottom layer. So the actual evidence that we would look at would be different for our local authority assessments as opposed to a GP practice or an integrated care system, and so on. So this is where we've built our specific evidence requirements, and of course lining that up with the current best practice standards and guidance, whether that's Care Act statutory guidance or information that NICE have published, or Skills for Care, and so on. And you can see all of that on our website. You can see kind of each tier of that, how that plays out for local authorities, and exactly what we'll be gathering, the data that we'll be looking at, and the best practice that we'll be having regard to. So do take a look on our website to look at that in more detail. Thank you.
This really just sets out the list of organisations and people that we have been working in partnership with to get us where we have. Dave sort of alluded to it when he was talking. The actual framework, the single assessment framework, is a result of at least 2 years of very careful co-production and consultation with a range of people. When it comes to the local authority angle, of course, they've been different additional people that we've been talking to. We've got the Department of Health and Social Care on the list, but there's another government department with a very close interest in this, and just give myself an acronym warning. It's the Department of Levelling Up. It's Michael Gove's department, DLUC we call it. Yes, but so the Department for Levelling Up Communities, they have a very close interest in and responsibility for local authorities. So they clearly, in partnership with the Department of Health and Social Care, have got a great interest in this work. we're working closely with their teams to make sure that this is going to be a good fit and not be too burdensome. I know it's something when I'm in conversation with providers, we frequently talk about is that the frustration that you understandably feel when more than one organisation asks you for the same information. So we're really trying in this partnership to see what we've got, what can be shared, and really minimise additional burden on organisations by asking for extra if we can get it from elsewhere. So the local government authority and ADAS, which as I'm sure you know is the Association of Directors of Social Services, they have been working very closely with us, really helping us to look again at this landscape that, you know, for over a decade CQC has had no responsibility for assessment. So they've been very valuable partners. We've had an external sort of reference group of people working with us, and other organisations who assess in the area of local authorities, for example, Ofsted, have all been at the table. So it's been very much, you know, working with others who know the landscape well, and we've still got further to go. But yeah, that's how we've got to where we are today. Move on and talk about what we did when we did our test and learn activities. I mentioned Hampshire and Manchester. We're very grateful to them. They really helped set us on our way. We only looked at two areas for this very small test. The pilots that we'll come on to talk to you about are a fuller assessment, but it did help us really. Well, it showed first that the single assessment framework was a good fit for this work, and it showed that we need to be really precise in what we ask for in terms of information. We learned that we can do many things over Teams and Zoom, that we can take account of, you know, it doesn't all have to happen at the exact assessment window. We can look, you know, back and forwards and take on information as it comes in. So it was very worthwhile and really helped us to sort of focus. And now we're moving into that next stage of that fuller end-to-end piloting to really before we go to full rollout, because this is a hugely significant change for all concerned, for the local authorities, for providers working within a local authority area, and for us. So we're going to go carefully and have a further set of pilots before we go to full rollout. Okay, so the interim guidance is up on the website. There'll be some links at the link is on the bottom of the slide. Fantastic. So that's now available to look at. It sets out the high level framework, so you can in more detail than we're obviously able to cover on a webinar like this. So it focuses on the themes, the quality statements, the 9 that Dave referred to that we'll be using. It will explain the evidence categories that we'll take account of, how we're going to go about the assessments, how we're going to report, and the intervention and escalation. So this is a significant difference from our work with providers, in that we don't have the sort of intervention and enforcement powers that we have in other areas of our work. So that will involve, as is set out in the guidance, that there'll be set circumstances in which we refer an organisation to the department with a request for additional support to improve. So are we going to expand and update this guidance as we go, and it'll form the basis. You know, the detailed end-to-end process will be clear as we get through the pilots and nail the last few things down and include it. Right, so April into the autumn. So from now, we are embarking on this now. we are going to look at some evidence across all 152 local authorities around the 2 quality statements that you can see there. So care provision and assessing needs. And we are going to look at published data, and examples are included on the slide: market position statements, joint strategic needs assessments. And we will publish the outcome of those reviews, but not individually. It will just be overall as to what we're finding in terms of themes and issues across those 2 areas. So we think that will, well, we're confident it will add value. And it will be a tool in which we can look around, because I'm confident we're going to find areas of really good practice, but it's quite hard to know when you're in one organisation which other organisations are doing this really well and you might be able to pick up tips from. So that this will be our first sort of look nationally at how things are. As I say, we're not going to publish it individually, but we will be able to pick up on examples of good practice, challenges and themes, and we'll be publishing that, possibly some of it within our annual State of Care report and possibly some separately, but we will certainly share what we are finding. Okay, I think at this point I am handing over to Amanda. Thank you.
Thank you, Mary. So as Mary's just been talking about our published evidence, if I can have the what we're going to be doing alongside that work is the pilots of up to 5 local authorities, and that's between now and September. We'll be carrying out the full end-to-end assessment, and we'll be incorporating all the 9 applicable quality statements under the 4 themes that we have. We'll be publishing the reports. We'll be publishing them as a group in the autumn, and that will follow a robust quality assurance and moderation process. And what we want to do is build on what we've learned from doing the test and learn and the 2 quality statements, and build up some of the methodology that we've been using in the way that we gather our evidence. And so that's been really valuable learning that we can bring into the pilots, and then we can take that forward. We have said that we will be publishing the rating, but that will be very clear that it's an indicative rating to reflect the fact that these are pilot assessments. And we have invited all our local authorities to volunteer to be part of this pilot, and we do have a number who've expressed an interest, and we'll be selecting them against a set of criteria, which, if I can have the next slide, I can take you through. So we want to make sure that when we're selecting our local authorities for the pilot, that we have a good mix of different local authorities. We want to make sure that we can pilot our approach on local authorities that are in different sizes and structures, so a unitary authority or a county council or a London borough, that we've got the mix of rural and urban in different geographical locations. We also want to look at the terminology with the integrated care systems, and as you'll hear in another webinar, our integrated care system work will be doing some of their own pilots later on, and our local authority work will inform their assessments of the integrated care systems. So we will also be looking at some local authorities who have been doing some self-assessment or peer reviews. And we'll make sure that we've got a mix of different political makeup of the councils. And what we want to do is, as Mary has said about the burden, we want to make sure we take into account anything else that's happening in that local authority during our piloting period, so local elections or other regulatory activity. So we're going to be using all of that to select from our list of volunteers the group that will be taken forward. As you'll be aware, for our provider work, we've been doing regulations of providers for a long time, and we have a good picture of the quality of services across England. As the powers for doing local authorities is a new duty for us, it means we don't have this national picture, so we need to establish a starting point. So once we have finished our pilots and we've been able to evaluate and put all the evaluation into practice, we will then be doing formal assessments of each local authority to give us that starting point and a baseline of our local authorities. And we'll be starting that in the autumn, And in our first tranche, we're aiming to carry out up to about 20 of the local authorities. And then we'll continue that as we go through 2024. And we will then actually be able to publish, probably in batches, our local authority reports and our ratings in line with the government asked to do that. But how we actually do that at the moment, we're still working on with local authorities and DHSC. And overall, that will give us a good national picture based on our independent assessments that we can then take forward into doing, once we've completed that, into doing our sort of ongoing regulation of assessments of local authorities. So that's the bit on the pilots and what we're planning over the next few months. And I think I'm handing back to Mary.
Thank you very much, Amanda. So we are now open for questions. So colleagues who've been monitoring the chat, could you tell us about some of the questions, please?
Absolutely. Thank you, Mary. Some great questions coming through, so please do feel free to keep posting them in the chat if you have any more. And we've had a couple of questions on the pilot work. Firstly, whether we already selected the pilot local authorities or whether people can still apply to be one. And also some people asking whether we think there are any benefits of being one of those pilot local authorities. Mary, would you like to start with that?
Okay, so we haven't made our final selection yet, so it's not too late. If there are any authorities on the call who were humming and hawing, should we, shouldn't we, I'd encourage you to come forward. We will be making our final selections the end of next week, so it's a small window. Of course I'm going to say this, aren't I? I think there's huge benefits it being involved in the pilot. There's certainly, very selfishly, a benefit for us. We learn so much when we try things out. And if I think back to the feedback we had from Hampshire and Manchester, they certainly got a lot of benefit from being part of the test and learn, and their directors have spoken publicly about that. One of the things they learn, they helped us learn about the sort of preparation that's needed to avoid the pitfalls of over preparation, which can be a danger. And also to very happily discover that we weren't as scary as people thought we were, which sounds like a trivial point, but any of us who've been school governors know how you feel when you've got an inspection coming up, or if you've worked in another area where you're subject to regulation, as you all are on the call. It's a serious business, and you want to represent your organisations well and do the best for the people you work with and the people you provide services for. So it's human to worry about it, but in fact the experience in both places was that they found the inspection teams knowledgeable, interested to talk to people and understand what they were up to, what they were proud of, and how they were addressing the challenges they had. So we left both places feeling better about the process, and even went so far as to say they enjoyed it. Now, which I was delighted to hear. So, and it's a chance to get an early look, isn't it, at the methodology and how it goes. So I think there are benefits, mutual benefits, but there's certainly huge benefits to us at CQC in getting this right. And of course it's a sort of service for everyone, isn't it, because it will help us get the process better. So yeah, I hope that's enough of an advert. If you're teetering, come forward and volunteer. Thanks, Sam. Next question.
Thank you, Mary. We've also got some questions around the evidence categories we'll use for local authority assessment. So the first one is about whether we'll be using the observation category and what that might mean in practice for local authorities. I don't know if Dave maybe wants to start off with that one.
Yeah, sure, will do. We're not using observation. Early on, we considered whether observing meetings might be helpful, but through our ongoing engagement and development of the approach, we just that doesn't feel like an essential part of what we need to gather. So we're being really careful, as in our ICS and our provider models and how we apply the framework, just to be really sure that what we're looking at is the essential material. So we won't be using observation. What we do need for each quality statement varies. So we've got that list of 6 to pick from. Although, as I've said, observation is off the table, and it depends on the topic which of the remaining 5 that we actually deem to be essential. So I hope that helps. And as I say, that is all available on our website, so you can see how that applies.
Great, thanks, Dave. And we do have a slightly more specific question around evidence, particularly around case file audits, and if that's something we're considering doing as part of the assessments.
I can see Jeanette's come off, so she may want to add. We will be tracking individual cases, so essentially people's journeys through the system is a really powerful tool that we use in our provider regulation, and we used it to great effect in our local systems reviews a few years back. So we will be tracking individual cases essentially to understand people's experiences. I don't know if Jeanette wanted to add anything to that though.
Yeah, can do. Yeah, as Dave said, one of the ways that we'll understand people's experiences is through case tracking, and that will inevitably involve looking at some records and talking to people who are involved with that person's care and that individual. With regards to actual case file audits, I know this is a key element or a key activity of some other regulators' work, but within this work we would be looking to see how does the local authority itself do its own audits, how does it govern its work and its processes. So we would probably look more to the outcomes of the local authority's own audits rather than spending our time doing that audit ourselves. I think that's a more appropriate way of understanding the processes and the governance around quality, consistency, and so on. So it's at this stage, it's not a required evidence item or activity. Of course, when we do the pilot work, we will be able to have a kind of better insight into whether that's the right way of going about it. But at the moment, that's the position. Hope that helps.
Thanks, Jeanette. That's really helpful. Then the next question, I might come back, start with Mary again for this one. So I think a lot of people are quite interested if we've got an ambition to start publishing best practice examples that local authorities could use to help understand what we might be looking for when we do assessments.
Yes, absolutely. That's our ambition to do that. And with some of the changes that are happening in the background at CQC with the new technology and a new website and so on, it will be much easier for us to, for people to look for best practice examples. At the moment, it's been a bit of a needle in a haystack at times if you're providing a certain service and you want to look for others. So I think we'll be able to draw those examples together in a much more accessible and faster way than we've had in the past. And I think, we haven't made sort of detailed decisions about what sort of publishing we'll be doing of that, but I would expect us to highlight things in our annual State of Care report, and we might well have additional publications along the way as we find things. And as I say, we'll be able to do that in a much smarter way when we finish with our getting all the new technology in the background. But that's been the whole purpose, is to make things easier to share and discover, because if this works about anything, it's about improvement, and we want to be actively enabling and supporting that.
Thank you, Mary. We've also had a question about, I think, a bit of a concern that local authorities are also going to be asked to report quality in a quality assurance way to ICBs, integrated care boards, and a bit of a concern there may be some duplication between our work and what they're being asked to do in that space as well. don't know if we can offer any reassurance that we're trying to avoid that.
Well, I can certainly provide assurance that we're trying to avoid that, and I might bring Dave in a moment, see what he might have to add to this. I think we will stick very closely to the assessment of the Care Act responsibilities that we've been asked to look at. And I mentioned earlier about, we absolutely want to avoid duplication. We are also going to be assessing integrated care systems. And one thing that we're really keen to make sure is that the voice of adult social care is well understood as part of those system assessments. So within a particular system, we will want to know from the local authorities and from partners in that system as to how well they feel that social care is heard and importantly understood. So I think I absolutely get the concern about, well, we've got the ICBs as well to report to, and that's right. But I think this framework now will give the voice of adult social care a much firmer footing on which to be heard, because those of us who work either in the commissioning, the provision, or indeed the regulation of services, we know how important it is to get that full breadth of understanding of adult social care. It's not all about discharge and ambulance queues, though that obviously is an important element, but it's far more than that. And really understanding how great care services can help, help people turning up at the front door of the hospital or delay that need for more acute care. So having that really understood, I think this is a means now. I'm very excited about it because and we can help with the work that with the local authority assessments we make will be an important part of the assessment of those wider systems. But let me bring Dave in to see if there's anything he would like to add on this point.
I think that was really well put, Mary. I couldn't add anything to that. Thank you.
Great, thanks both. We've also had a question about the initial phase of this work where we're looking at published evidence to build a national picture, and I think some concerns that for us to have a really good view of what's happening, it might need to include information that's not necessarily published or in the public domain. And I guess I wonder if that's something we've thought about or considered in this approach to make sure we're given the fullest picture possible. I don't know who would like to start with that.
Okay, so let me just clarify. So is this the reference to the work we're looking at looking at all 152?
That's right, yes.
Yeah, okay. Yes. So we're only looking for that purpose. We're only looking at published information, which is why it's partly about not putting a burden on people and using what's already out there and we can find. But the fuller context of that's why it's not being published on an individual basis. The fuller assessment of that will take place when the full assessment happens. I don't know, Dave or Amanda, if there's anything you'd like to add to that.
Yeah, I suppose it might just be helpful to explain a bit of the context. The Act that gives us these powers also sets out that the Secretary of State can and should essentially articulate what their objectives and priorities are. Now that's been delegated to the Minister of State for Care, Helen Whately, and that minister, the Department of Health and Social Care more generally are really kind of key drivers here. They're funding this work. They've given us these powers, and they have this power to set objectives and priorities. The challenge that we kind of faced with that is understanding what those are and aligning that with the work that we need to do at an individual local authority level, within budget, within capacity, and that's how we've ended up with this kind of almost two-pronged approach. So we will deliver this kind of thematic analysis based on to make sure that we're not adding any burden, and also that we can work, as I say, within our capacity. looking at what already exists to get a flavour. We're not pretending that we can answer those quality statements, assessing needs and the one around commissioning and care provision, but it gives us a thematic insight that we can share back to the system, share back to the minister and the department. And it's actually the first step towards those individual assessments as well, so nothing would be lost. So as we look at individual local authorities' published information and the data that is already in the public domain and that relates to those authorities, that's starting to fill those evidence buckets, if you like. And as we come back to those individual authorities and we gather people's experience and we speak with staff and leaders, get the provider perspective, we're filling those buckets. So it's an iterative process, but it's kind of an early product, I suppose, an early output that we can deliver for the system. And as I say, to kind of address the needs of the minister, because we're not free from, we don't have a completely free hand here. I'll be honest, you know, that's how our powers are set out.
Thanks, Dave. So we've also got a question that I think is looking a bit further ahead in terms of this work, and wondering that once we're kind of in full steam of local authority assessments, what the kind of frequency of reassessment might look like, what might be the gap between an assessment at a particular local authority, and whether we're thinking about some frequency rules around that. So I don't know if that's back to Dave for that one, or Mary, if you wanted to start.
I'll start and then hand to Dave on this one. I'm smiling because it's such a live topic. What an insightful question. Thank you. So we need to do all 150. So we do our 5 pilots, then we do this sort of 2 years or so of baselining, get all 152 local authorities assessed. And then we'll be in a new territory. Now, we do have to agree frequency rules with the ministers. And at that point, I'm going to hand to Dave, because I think he'll be more up to date than me on quite where we are at the moment.
I mean, essentially, yeah, we do. We have a legal requirement for our provider work as well, to set out the frequency of our assessments. But as Mary said, we're sort of 2.5 years away from needing to do that. So through channels such as this, we will be absolutely wanting to engage and develop our approach to that. We're still on the provider side, we're still working out the right balance, the right frequencies there. And I suppose the key thing to say here is that the structure of the single assessment framework, the way that it is much more it's more structured and kind of modular, allows us to flex and adapt to different circumstances, and allows us to focus on areas that might need looking at more frequently, topic by topic, and to reflect improvements in a way that our current approach really doesn't allow us to. Really, at the moment, we have to effectively look at a whole key question in order to be able to reflect ratings change, whereas with our approach to scoring and our more granular approach to how we're breaking the topics down, we've got a much greater degree of flexibility. So when we do get to that point where we're setting out how often will we reassess, it will be on that basis. What are the important areas? What will change more frequently? What rules need to govern the frequency? So you'll definitely be hearing more about it as we get towards that point.
Great, thank you, Dave and Mary. That's really helpful. So the next couple of questions are kind of coming back to question of evidence and where we'll collect it from. The first one is really interested in, I guess, both in the pilots and the full assessments, how we'll work with providers and engage with them to understand their experience of working with their local authority. Mary, did you want to start off on that?
Yes, thank you. Another great question. So this is an area we really need to explore through the pilots. So we have one approach will be to look at the local provider organisations. So it'll be different in different places. So we're going to need to be really flexible for the different arrangements we find in different areas of the country. But where there's an established provider organisation, then that would be a place that we, that organisation we would go to. But we'd also have a look to see whether that organisation was truly representative, because let's be frank, some are more representative than others. So if we looked at the membership of who's covered by this organisation and found a swathe of services that weren't, then we'd need to think about how we reach out to them. We will, of course, also be talking to our own local teams who will have a good idea of the landscape of care provision in their particular patch. So when we're looking at Somerset, we'll want to talk to our teams that cover Somerset and get there. They'll also know about contacts they can point us to, but we'll also have from our provider activity a sense of services in an area. But we really want to be flexible so that we can make sure that people have an opportunity to share information that they want to do. We've had a number of different approaches over the years in provider land as to how best to do this. So we need to learn from that. But as I say, be flexible, because we're not expecting to find a uniform situation in every local authority area that we go to. But Dave, do you want to come in on this?
Again, a really fulsome answer there, Mary. I suppose the only other thing to add is we also engage nationally with trade associations. So if you are a member of those associations, then that's another route. But yeah, I mean, as Mary said really clearly, we just want to make sure we've got maximum flexibility and just make sure we do get that provider experience covered under that feedback from partners evidence category.
Thank you both. So kind of on a similar theme, people were really interested on how we'll bring in the views and experiences of people in the local area as well. So people who might use services, their families, carers, friends, etc. So I wonder if we could say a bit more about that. I know some people in the chat have suggested working with Local Health Watch or using our experts by experience in this space. Dave, I don't know if you want to start, because I know you've talked about the I statements already, and people's experiences of care are a key evidence category for us as well.
Certainly, and if we want to get into a bit more detail, then Amanda or Jeanette, they will want to come in, and my dog's just come in as well, so perhaps they'll have something to say. Yes, we will be making use of all the groups that currently exist, and partners such as Local Health Watch, really important. Again, a bit like providers, really, any local groups and forums that we can join and gather people's experience from. What the local authority themselves will have gathered in the kind of outreach work that they do, focus groups, and absolutely, Sam, as you say, the I statements are kind of at the core of this. They give us a framework, and they give us almost a target to kind of measure to, essentially. And I know the team are starting to look at how those I statements can translate into a kind of a set of questions on a way of probing and understanding people's experience that relate back to those really clear expectations that the I statement set out. So again, on the website, we do say for each quality statement under people's experience exactly how we're looking to get that. But I don't know if colleagues do want to add anything at the moment, Jeanette or Amanda.
The only other thing to add there is that we will be interested to see how does the local authority itself go about hearing from people in its area and understanding their experiences and the outcomes of the care and support they get. So there will be work that we do as an inspection team, if you like, going actively seeking out feedback in the various ways that Dave and Mary have described. But then alongside that is, how does the local authority do that itself? How does it understand people's experiences, and how does it use that to drive improvement, to invest in its resources in certain areas? So yeah, thank you.
That's great. Thanks both. So the next question, kind of a more practical one, is just trying to understand what length of notice we might give local authorities before our assessments. So both in terms of the pilots that are happening earlier this year, and then the assessments happening later in the year as well. I don't know who'd like to take that one.
I'll have a go, but I'll keep an eye on my fellow presenters to see if I've got this wrong. So I'm not sure that we have nailed down the detail of that. I think that in our planning for the pilots, we are saying that we would make our formal information request about 3 weeks. We give people that amount of time to sort of come back to us. But I think we would probably, when we've made our decision on the pilots, I think the plan is to let those organisations know, and then to agree the dates. We've got an outline plan, as you might imagine, but just thinking about what we learned from the test and learn, there was a very significant event that Manchester was involved in, so we sort of flexed the dates to accompany that, and then got hit by a heat wave, but that's another story. But there will be it's not like provider sort of visits, in that we're not going to be observing care. So it's so I think we need to nail down, unless anybody can wave at me and tell me that we have nailed this down. Amanda's waving, so over to you, Amanda.
I was waving, but not to say that we've nailed it down. just to be clear. So I think it's in terms of timescales, I think that's what we will be piloting to work out, and it will build up as we go along. So while we will be sending out for the information returns and that kind of thing, we'll then work with the local authority to plan the actual field work activity that we'll need to do. So while we'll try and have that in a discrete period of time, for say, you know, a few days over a week or something like that. So that's where the discussion comes in. But obviously we'll have a time frame to work with. But as we build up, we'll be able to be doing more assessments in the baseline concurrently, and analysing the information and everything, so that we get in. So it isn't a case of we're going to be giving notice that says on this day you've now got 5 weeks or anything like that. So there will be that element of discussion. And what we want to do is in the piloting is work out how long does it take to do the information return. How do we get really good at identifying the gaps and sorting out the fieldwork activity we need to do? So all that will be part of the pilot. So there isn't a kind of tight time scale in terms of it's got to be a week or 2 week or anything like that notice at this moment in time.
Okay, thank you all. We might actually stay with you for the next question, Amanda, if that's okay, because you've talked a bit about information returns there, and we have had a question about how exactly we might request that information and the kind of way in which we'll ask local authorities to submit it. So I don't know if we've got an idea of whether it will be via email or via a web portal or something similar.
Yes, so we have and Jeanette will be best placed to talk a bit more about the actual information return itself, but we are setting up portals for information to be returned to us, and it's something we found during the test and learn, was how the local authorities could submit information to us. So a sort of portal is the easiest way to do that. So we will be setting that up, and when we contact the local authority for the information, we will be giving them the information there of how to submit it by that route. But Jeanette, do you have anything to add on the information return?
Yeah, so the information return is basically designed to enable the assessment team to gather and review documentary evidence that the local authority should already have in some form, to gather that ahead of any fieldwork activity, so that they can actually have a good look at the information and start to understand and get some insight about the local authority, and really think about where the gaps in, what kind of other evidence do we need to make our assessment, how can we maximise the use of our time when we actually go to the local authority, so that, you know, we're asking for the right information and not duplicating. So everything that's listed on the information return is part of the required evidence items that are included in the assessment framework, and we've already referenced that's available on our website. So it's mainly things that are listed under the processes evidence category. Things like a market position statement, the approach to assessments, and the kind of pathway through the system that an individual might experience from coming to the local authority from first contact through to having an assessment, to having a care plan, to having a review, etc. So it's that documentary information that the local authority is likely to already have that they can send in to us. We're very clear, we're not expecting things in a particular format. Local authorities might call things by different names, and that's absolutely fine. But in essence, it is an opportunity for us to request, collect and review as much information as we can ahead of doing that on-site kind of fieldwork activity. So I hope that answered the query.
Thanks, Jeanette. I think we've maybe got time for one or two more questions, but just to say, if we don't manage to get to your question today, we are going to be sharing more information on this work in the coming weeks. So we'll try to address ones we don't answer today then. But the next question, so this hopefully is quite a quick one. And people just wondering whether we'll publicly announce who the pilots are going to be with. Mary, I don't know if you want to come back on that one.
Yes, I think we'll do that. It would be yeah, I'm sure we will.
Fantastic, a nice and easy one to answer. We've also had a question about how we'll be looking at how local authorities work with other stakeholders in their area and other types of organisations. So I know we've already talked about providers, but I think people are wondering just about other types of organisations as well. And I don't know if we've thought about that in detail.
Well, I don't know about the detail, but we have, as long as the absolute framing of our interest are the Care Act responsibilities. So where there are other organisations, I think I saw a question in the chat about what about if part of those responsibilities are commissioned and delivered through another organisation. So say there's an organisation commissioned to deliver support to carers, then we would absolutely be interested in that and how that's working, and probably want to speak to people as part of the assessment. But what it wouldn't be is a judgment of that separate organisation in its own right. It's about the local authority and their responsibilities, and if they've chosen to discharge those responsibilities in partnership with others, then that would bring it. But it's sort of within the remit, as it were. But as I say, it's all about the local authority and their responsibilities. And again, with carers organisations, I mean, I've been talking to a national carers organisation who's given me the very firm steer that we need to make sure that when we've got a carers association or some sort of carers support arrangements, that we need to make sure that is genuinely reflective of the situation, you know, the support given in that area. So I think it's going to be this lack of uniformity, quite right, the flexibility of arrangements in different areas. There'll be different third sector organisations. When we looked at Manchester and Hampshire, there were different charities involved in the provision of services. I visited a substance misuse service that was delivered in that way. So yeah, we need to be absolutely open to what's happening in that patch and engage appropriately to make that sort, you know, full and fair assessment. I hope that answers that question.
Fantastic, thank you, Mary. So I think we've just got a few minutes left in today's session. So I think that's probably all the time we have for questions, unfortunately. So I'm just going to hand back to you, Mary, to take us through the last couple of slides.
Okay, thank you. Well, thank you so much, everyone, for staying on. I'm looking at how many people have stayed on for the whole hour. That's absolutely fantastic. And thank you for your questions. It really helps us in our thinking to see what you're asking. So what we're looking at on this slide is how to stay up to date. There's some links there to our bulletins and blogs. And if you're not already engaged in Citizen Lab, I'd encourage you to have a look at that and sign up, because we are absolutely serious about our engagement, because it just helps us to do our jobs better. That's to get this right. So that's how to stay up to date. Huge thanks for joining. And there we are, a thank you slide. And as I say, thank you for staying for the hour. I hope it's been helpful, and your questions will help us shape our future communication. So we will aim to answer everything that we haven't got to today. But thank you all very much.